was the case at the beginning of the discussion about the lockdown. It was the case that one or two people put forward the idea that it should be London specific for all the reasons that we know. But the point was made, well, it'll be difficult to police. If you say that someone has to observe social distancing rules and can't go to the pub in Kingston, what happens if they go over the River Thames and go to the pub in Surrey? It becomes difficult to manage. It was felt that it was appropriate to do it on a nationwide basis. And I think it has been effective because we have seen the virus spread, and there have been flashpoints and outbreaks across the United Kingdom that have been worrying and concerning. One area where we may be able to explore having the lockdown eased more would be in island communities. And Bob Seeley, the MP for the Isle of Wight, has suggested that we may trial contact tracing on the Isle of Wight before it's rolled out nationwide. And if we do that, we might be able to use the Isle of Wight as an opportunity to see how we can relax those measures. And I think similar suggestions have been made by some of the island communities in Scotland, but obviously that's a matter for the Scottish Government. An enormous amount of work was done to anticipate a flu pandemic, and work was also done to anticipate a SARS-style outbreak. But what wasn't anticipated, and I think this is true worldwide, was the impact of a virus quite like COVID-19 that combines elements of the flu pandemic, and obviously it has a relationship with a SARS-style outbreak. With respect to preparation for a pandemic, we had a stockpile of PPE and we had legislation ready to go as a result of the work that had already been done. So the Coronavirus Bill, Act now, which was agreed across all four governments, the fact that those legislative provisions were in place was because of work that had been done by the Cabinet Office, the Department of Health and others to put us in a strong position. It was the case also that the stockpiles for a flu pandemic have helped, but there were additional requirements because of the specific nature of the virus, which, following scientific advice from the Advisory Committee NERVTAG, we sought to source to complement the pandemic stockpile. But the nature of this particular virus has meant that there's been a need for additional PPE that wouldn't necessarily have been the case in a standard flu pandemic. And you are right, there's been a global demand for it. One of the things that many of us will reflect on is whether or not the sources of supply for PPE are too concentrated in a geographically limited number of countries. And that is definitely a lesson to be learned.